chose Lincolnshire Co-op because they're one of the largest pharmacy chains in the area, and I was particularly impressed when I spoke to the management team beforehand. I had really good support from my manager, and the pharmacy team that I worked with were really supportive. We arranged a cross-sector placement with a local hospital, which gave some valuable insight into a slightly different pharmacy role. I think the main benefit really is the patient contact you'd get in a community pharmacy, being able to get to know patients, to manage them, to be involved with diagnosis with minor ailments. There's a lot of soft skills there which you gain, which you usually don't quite have the contact with the patients or the time to build a rapport like you do in a community pharmacy. In a community pharmacy, you get more variety with what the patients might turn up with. There can be all manner of ailments, and you have to manage or signpost appropriately. So it's a lot more thinking on your feet, I think, compared to a hospital where you might be on a renal ward or cardiac ward, and you have a specific area and objectives. You can get surprised when you're in a community pharmacy, so you've got to have a good breadth of knowledge to be able to deal with it well. You get the benefits of the patient contact in the community pharmacy. You get a large number of patients, you get used to them, whereas in the surgery you see a lot of clinical, you get a lot more clinical skills, and you have involvement with patient care on a different level really, so you get the best of both worlds. Previously people have only done their placements in hospitals or community pharmacies, so that split placement I think is a really attractive proposition. It's what I would go for if I was doing my time again. So since I qualified from my pre-registration year, I started off working as a relief pharmacist around our branches. I then moved into managing a branch, which was our Birchwood pharmacy. Between then I've also done stints looking after a private hospital, working within local community hospitals and prisons, and currently I'm in a role where I work in general practice surgeries and look after a team of other pharmacists who work on clinical services within the surgeries. Personally, now I've been with the Co-op over 15 years, and the reason for that is they've got a really good management structure which is very supportive. There's lots of opportunities to work in different areas rather than just solely community pharmacy. So I think I've got the variety in my work and the support from the team to help me do a good job at the end of the day.